So if you want to not use the word informed consent, let's just use the term setting realistic expectations that you won't disappoint. Okay? That's what informed consent really is about. Okay? Like, there is a small chance that you could have a numb lip. That's setting an expectation. Okay, I'll do the procedure, but there is a percentage chance that you'll have a numb lip for the rest of your life, which, unless you're a saxophonist or a singer, you'll probably live with. So that's what informed consent is. It really needs to be thought of as setting expectations. There is a reason why you should do written things that people sign, okay? And that is because people absorb information differently depending on who they are. So there's a few things. Obviously, almost every single one of my patients has a full set of photos, so we're going to show them their teeth on the photos. That also is part of both the consent and the acceptance process, because people are very visual these days, and if you show them their teeth with the big hole in it, there's just no doubt that it needs treating. Okay, and actually, most people think their teeth are worse than they really are. So you show people a really healthy set of teeth and they go, yuck, okay, because they think their teeth are all white and they're full of stains and stuff. So the consent process for me involves photographs. I show them all the radiographs. It takes time, and the more complex the treatment, the more time it takes. So it's not uncommon for me to have spent 2 hours with a patient before we lay a scalpel or a burr on their tooth. So, and it... often the consent process also involves preliminary treatment to see whether you can stabilise the mouth. So it's very common as part of my consent process, or realistic expectations, or just good professional behaviour, to put the patient through, say, a perio program or an oral hygiene program or a caries reduction program and see how that goes. And so there's a lot of my patients who I basically come in going, I want a makeover, or essentially what they're asking for is a rehab, and I'm saying not until your mouth is clean. Okay, so because now you go, oh, that's pretty tough to look that much, a wheelbarrow full of money in the eye and say no, but actually, all you need to think about is how much fun it would be to do that dentistry, and then give the money back.
Hey, if you enjoyed this snippet from the Protrusive Dental Podcast, be sure to check out the full episode on www.protrusive.co.uk. It's also available on Apple Podcasts, Google Podcasts, Spotify, Amazon, you name it, it's everywhere. Also on YouTube. So check out the content. If you like it, please share it with a friend. Thank you.